for the patients who have cancer in the body of uterus, that is called endometrium or uterine cancer. A surgeon does surgery in either laparoscopically or robotically, that he'll leave behind cancer cells. A person who is trained in laparoscopy or robotic surgery can do a much better job, especially endometrial cancers are more prone in obese patients. Robotic surgery again is having more advantage over laparoscopy surgery. Wherever we need stitches, it is easier to do that in robotic surgery. Hi, this is Dr. Satish Pawar, Chief Surgical Oncologist, Kaizen Hematology Network, Hyderabad. Today, let us talk about the difference between open laparoscopic and robotic surgery, especially in endometrial cancer, that is the patients who have cancer in the body of uterus, that is called endometrium or uterine cancer. A lot of people have this misconception that whenever a surgeon does surgery in either laparoscopically or robotically, that he'll leave behind cancer cells. This is absolutely wrong concept. So, the studies whichever have been done have said that laparoscopy or robotic surgery, which is minimal invasive surgeries, are equally beneficial or equally competent enough with open surgery. That means that a person who is trained in laparoscopy or robotic surgery can do a much better job when compared to open surgery, because what happens is, especially endometrial cancers are more prone in obese patients, and these patients already have hypertension, diabetes, they'll have compromised lung function, their mobility will be less. So, hence they recover faster with laparoscopy or robotic surgery, and the chances of them getting DVT, that means deep vein thrombosis, also comes down drastically, because they are, if we operate in the morning, by evening they are mobile, they can walk, and by next day we discharge these patients. Apart from that, the biggest advantage are these laparoscopic or robotic sets which have inbuilt ICG in them. So, what this ICG does is, this is an indocyanine green dye which we give it in the cervix, and this dye goes to the lymph nodes. So, generally endometrial cancers which occurs in the uterine body, the next spread is to the lymph nodes. So, in the scans, if there are no lymph node metastasis, then we offer these to those patients where there is no lymph node metastasis in the scan. That means there are no cancer cells in the lymph nodes. So, we give this dye, trace the dye to the lymph nodes, remove only those lymph nodes which are stained with the dye, and send it to the pathologist for frozen section. This report comes in another 20 to 30 minutes when the patient is already under anesthesia, and once if the report is negative, then we don't clear the lymph nodes. The biggest advantage of doing this is that they'll not have lymphedema. That means that swelling in the legs is reduced, complications because of the lymph node dissection is reduced. So, all this becomes a definite advantage by doing this procedure. Apart from that, the recovery is much more faster. We can start treatment, the adjuvant treatment, that is, say for example, if the patient needs radiation or chemotherapy in addition, this can be started very well faster in these particular patients. So, robotic surgery again is having more advantage over laparoscopy surgery, because the robotic surgery arms go deep in the pelvis where there is narrow space. If the patient is obese, bulky, and to pass laparoscopic instruments deep into the pelvis becomes difficult, and if the size of the uterus is large, it is difficult to do surgeries by laparoscopy. Hence, even difficult to do surgeries by open surgery because of mere fat content in the abdominal wall, and it becomes difficult for the assistants also to assist, and the visualization, which is specially very much it's a 3D visualization, and the enhancement of the visualization, which is much better than the open or laparoscopic surgery in robotic surgery. So, and the hand rotation, which is 360 degrees, the instruments rotate and we can operate in narrow spaces. Apart from that, even the suturing, that means wherever we need stitches, it is easier to do that in robotic surgery. Hence, robotic surgery is much better than open or laparoscopic surgery in this particular case. Thank you.